All right, so this is Senate Health and Welfare. It's back again on April 3rd, and we are going through a bill that has passed the House third reading, which we think will come here. And Katie, it would be helpful for you to go through it with us.
Sure. Good morning, Katie McKinney, Office of Legislative Counsel. So you do not have an official as passed House. What you have is draft 7.1, which is the Human Services Committee report. There were no changes, so this is very similar to what the actual report coming over from the House will look like. Okay, so just to give you sort of an overview of the structure of this bill, we have some findings and legislative intent, and then there's a new, in section 3, a new chapter created in Title 33 in the Green Book. So we create an ongoing program that has been referred to as VHEART. And so the various elements and components of that program are in Title 3 in that new chapter. After the new chapter, there's the creation of a time-limited advisory group. And there's also a request for an implementation plan that is really aimed to drill down on a lot of the specific policy decisions that need to be made to implement the program before it takes effect July 1, 2026. And then we have some appropriations language. So that's sort of the high level of what we're going to look at.
So my suggestion will be to go lightly through the findings and a little more into the intent, so that we can come back to those.
Okay.
And I think we got the gist around the findings.
Okay. Do you want me to skip over them for the time being?
Well, maybe give us the high level of intent.
Yeah, we can read them up.
Okay. So a big piece of the intent is the aim of working towards eliminating homelessness. And then when it occurs, as Representative Wood said, it's rare, brief, and non-reoccurring. And then it's the intent that VHEART, and I guess it's important on line 7, is a step towards ensuring that. So it's not meant to sort of end homelessness or necessarily achieve all of these items on the list, but it's meant to move in that direction. And then some of the specifics have to do with having a stable pathway to permanent housing, access to community supports, ensuring that housing first principles are used, and whenever possible to use non-congregate shelter. Also, importantly, and on the top of page 4, subsection C, it says that the intent is that VHEART would replace GA emergency housing and VHOP and HOP, the Housing Opportunity Grant Program, and that funds that were appropriated for those purposes would instead be used for this VHEART program beginning July 1, 2026. Okay. And then we get to section 3, which is the creation of the new chapter. So the program is the Vermont Homeless Emergency Assistance and Responsive Transition to Housing Program. As I've already said, the short title is VHEART, or the VHEART program. And then we get to a purpose section, which is similar to what was in legislative intent. That is that this VHEART program would replace GA emergency housing and HOP.
For our purposes in here, can you give just a short explanation of what the Housing Opportunity Grant Program is?
I would have to be very high level. I'm sure I'll hear from the experts, but when I think of HOP, I'm thinking of shelter services that are provided at the state.
I have a paragraph on it in my physical notes.
Oh, perfect. Thank you.
What's the column on?
Definition section. We have a definition for at risk of homelessness, means in peril of imminently losing a primary nighttime residence or being precariously housed. A community action agency where cross-referencing agency designated elsewhere in statute. Community-based shelter means a shelter that meets the department standards for the operation of shelters. Department is DCF extreme weather event, means extreme hot or cold temperatures or weather events such as hurricanes, flooding, or blizzards that create hazardous conditions for outdoor habitation by humans. Homeless is lacking fixed, regular, and adequate nighttime residence. That is what is currently in the budget language. Household means an individual and any dependents for whom the household is legally responsible, who live and intend to stay in Vermont. Excuse me. Households include individuals who reside together as one economic unit, including those who are married, parties to a civil union, or unmarried. Unsheltered homelessness means sleeping in a location not designed for or ordinarily used as a regular sleeping accommodation. I don't usually go through all the definitions, but I think in this case, it's sort of important to understand the distinction in all of them. So then in section 2204, we're at the top of page 6. This is where the program itself is established. So it's established in the department and shall be operated by the community action agencies and a statewide organization serving households that are experiencing or have experienced domestic or sexual violence to the extent funds exist. In subsection B, we have a list of the types of services that will be coordinated through the community action agencies. So the community action agencies are to collaborate with other community partners, including municipalities, the 2 continuums of care, Chittenden County Homeless Alliance, Balance of State Continuum of Care, and local housing coalitions. The program shall utilize coordinated entry and shall utilize but not duplicate the work of community partners. It shall include the following components: supportive services, and then we have a whole standalone section on supportive services in section 2205 to assist households experiencing homelessness, those at risk of homelessness.
Oh, there's a text. I'm sorry to interrupt you, but so we look at chapter 22. This is a new chapter.
Yes.
And will it be in the green book?
Yes.
That's all. Okay.
There is a typo that you'll notice on line 16 that pursuant to section 2205 of this, it's twice. I'm on page 6. So it may be cleaned up if the house clerk is willing to do it before it comes over. Otherwise, we'll clean it up here.
R after
what? I think we'll strike pursuant to section 2205 of this chapter because it's repeated in on line 14.
Oh, there it is.
Yep. Okay, another component, extreme weather event shelters. Operated or caused to be operated by a community action agency. Emergency shelters, operated or caused to be operated by community action agencies. There are 2 types of emergency shelters that we'll look at when we get to section 2207. And then another component of this program, sort of separate and apart from the work that the community action agencies will be doing, is that VHARD this to include supportive services and shelters specific to households that are experiencing or have experienced domestic and sexual violence, which shall be provided or caused to be provided by a statewide organization with population-specific service experience, and there's a standalone section for that, 2208. Okay. So now we kind of go back to the top of that list, and there's a standalone section for each of the listed items. So first, for supportive services, a community action agency in collaboration with other community partners is to offer or cause to be offered the following supportive services, which may vary in terms of manner and extent depending on the level of shelter a household utilizes or whether the household is at risk of homelessness or experiencing homelessness. Here are the services: intake assessments and services for diversion from homelessness, household needs assessments, individualized household plans to address identified needs, assistance obtaining and retaining housing, including financial assistance, referrals to other services and supports, peer-supported services, landlord-tenant outreach, education, and conflict resolution, housing navigation services, advocacy and progress monitoring, and interventions. So those are the types of supportive services that would be offered who gets those services and the amount of services they receive is sort of a TBA depending on what comes back from the implementation plan.
So in the first paragraph up there on page 7, starting line 7, support services, it talks about collaboration with other community partners. Is there any mention in here of collaboration with state agencies?
There is.
That's coming later.
There is. So this is for the delivery of services. But when we get to language about the department's responsibilities, it says that AHS is sort of ultimately responsible for the program and that all departments within the agency play a role.
Is there any, well, we'll get there in a while.
Okay. Next is the extreme weather event shelter. This directs that a community action agency is to operate or cause to be operated shelters in the state that shall be used during extreme weather events to shelter any homeless individual who seeks shelter. The community action agencies, in collaboration with community partners, shall prioritize funding for extreme weather event shelters by utilizing data available under this section and considering geographic access. A shelter offered pursuant to this section during an extreme weather event may include time-limited congregate accommodations and may be provided through agreements to municipalities or other entities. And then next we get into emergency shelters, and this is broken into 2 paragraphs. We have a paragraph on temporary shelter and a paragraph on transitional shelter. So at a minimum, a community action agency is to serve or cause to be served in a manner that complies with and builds upon federally required community planning processes, households that are prioritized and in need of the services of temporary shelter. So that's an important distinction between these 2 paragraphs, the word prioritized on line 16, because subsection A envisions that there would be an eligibility group sort of similar to what is currently in the fiscal year 25 budget. And one of the things that the committee and the implementation, the group looking to build the implementation plan would come back with was who should be part of that priority group. What group should be prioritized for receiving the services of temporary shelter? And then community action agency may.
Can we go through temporary shelters again and then on to the next type of shelter?
Sure.
Start with that.
Yeah. So temporary shelter, at a minimum, a community action agency shall serve or cause to be served in a manner that complies with and builds upon federally required community planning processes, households that are prioritized and in need of the services of a temporary shelter. A community action agency may provide or cause to be provided temporary shelter through community-based shelters. So remember, community-based shelters is a defined term that means meeting DCF adopted standards. Could be met through temporary use of hotels or motels, lease agreements for full or partial use of an existing building, need specific shelter arrangement or other arrangements or combinations of arrangements that comply with the intent of the chapter. In subsection B, transitional shelter, a community action agency shall serve or cause to be served by households in its region in need of the services of a transitional shelter in a manner that complies with and builds upon the federally required community planning process. A community action agency may provide or cause to be provided transitional shelter through community-based shelter. Again, that's the defined term. Master grant leases, developing shelter capacity or other arrangements or combination of arrangements that comply with the intent of the chapter.
Okay, so transitional, this is really the definition of transitional shelter.
Yeah.
Yes, okay. Now, does that, so locally there will be some folks around Springfield Prison, Department of Corrections facilities. Does that include people in transition there? Or not?
I don't know that transition so much means somebody but you think it,
Well, I'm just thinking
Like
someone
transitioning
coming
from a
out
correctional
of Department
setting.
of Corrections,
I
no
see,
place
yeah.
to go, do they qualify for assistance automatically, or how that, I mean, was there a discussion about that, that's all.
Yes, populations transitioning from corrections were definitely discussed. I'm caught on the choice of the word transition because I don't necessarily think here on line 3 that transitional shelter is meant to only refer to individuals transferring out of a correctional facility. But yes, to the
Temporary shelter?
to the extent, well, that is the subsection A. But to the extent that a person is exiting a correctional facility and there's not a different placement made, if a person any person finding themselves homeless, would be able to take advantage of transitional shelter.
No, we had, unless it's changed, a significant number of people still in prison because they
That's why.
cannot be released, or they will not be released unless they have an acceptable place to live. And acceptable places to live are very hard to find. So I doubt that that's a major. They may find an exceptional place to live and then find themselves exited from that.
What, so,
They
yeah,
can't
so
come out. They don't just get released into the streets.
And then the last, I want to call it component of what is offered through VHEART is the supportive and shelter services for households impacted by domestic and sexual violence. So as part of VHEART, the department shall enter into an agreement with a statewide organization with population-specific experience serving households that are experiencing or have experienced domestic or sexual violence. The organization shall provide or cost group provided various shelter and case management services to support households. And then we move on to first a section that details the responsibilities of a community action agency that are operating under VHEART because they have other obligations that are separate and apart from VHEART. And then the section after that is what are the responsibilities of really state government. Okay. And subsection A, the community action agencies shall serve or cause to be served households that are experiencing homelessness or at risk of homelessness in the state by providing supportive services, extreme weather event shelter, or emergency shelter pursuant to the sections we just looked at. If a community action agency cannot fulfill its responsibility under this chapter, the department is to work with other community action agencies or other appropriate community entities to assure there's not a gap in services in the community action agency's region. So that is, you know, if at some point a community action agency can't perform its obligations under this section, what the department is to do as next steps. In subsection B, the community action agency providing or causing to provide services in accordance with this chapter shall have existing or planned infrastructure to support households in the region, including an established leadership team, a human resources staff, and the ability to receive grant funding and issue sub-grants.
So the conversation here, with this means that our CAP would at some point be hiring people to do a lot of this work if they don't already have.
So the discussion upstairs was that the CAP could, but wouldn't necessarily be doing all the work. And that's why the phrasing is shall serve or cause to be served. So this would allow the community action agency to contract or enter into an agreement with other community providers in their region to provide the services required of it under this act. And so in order to be a participating community action agency under this program, the community action agency has to already or be working towards having this infrastructure in place that would support this work. It has to have a leadership team. It has to have a human services staff. I'm assuming most already do, but you have experts in there who would know. And then the ability to both receive grants, but also to sub-grant out. So they have to have that capacity. The Community Action Agency is to have the ability to meet the department's reporting requirements, including past history of reporting compliance. The Community Action Agency is to have community connections with other providers in the region, including local housing coalitions, housing providers, providers of coordinated entry, and providers of services to individuals who are older Vermonters, individuals who have disabilities, substance use disorder, or mental health condition, individuals re-entering the community after incarceration, individuals transitioning from the care and custody of the Commissioner for Children and families with children. And a community action agency has to provide plain language communications to households receiving services. Okay, so that brings us to the top of page 11. And now we're transitioning from the responsibilities of the Community Action Agency to duties of the department, which on reflection, I wonder if it should be, yeah, I guess it should be duties of the department. It's just that we start the next sentence. The Agency of Human Services, working with the department, shall have statewide responsibility for meeting the intent of this chapter, including statewide planning, system development, and the involvement of all the agencies departments. So that's the language that I was referring to earlier in response to your question, that all of the agencies departments are sort of pulled in as part of the planning and development work to create and maintain the system. In subsection B, for the purpose of providing administrative oversight and monitoring of the program established in the chapter, the department shall. Here we have the list of the department's responsibilities. The department has to adopt guidance regarding the extreme weather event shelters, when they should be operated, including flexibility for regional weather conditions, and also maintain a website with the locations of all the extreme weather event shelters in the state. Excuse me, in subdivision 2, include as part of any review of a community action agency that's required pursuant to Title III, where the community action agencies are designated, the community action agency's ability to perform the requirements under this chapter. So we have a cross-reference here so that an evaluation that is done on the community action agencies would also include their work under this chapter. In subdivision 3, consult with the community action agencies and the statewide organizations serving households that are experiencing or have experienced domestic and sexual violence to develop appropriate resource allocations and methods for adjustment that take into account available data, the presence of community-based providers and customary resource allocation methods, economic indicators, rate of homelessness, rental vacancy rates, and other variables as appropriate. So this is saying work with the community action agencies and the network to figure out how the resource allocation among the community action agencies should be determined using these factors. And then annually, the department is responsible for distributing the funding to each community action agency in the network. The allocation formula that was developed in the previous subdivision that we just chatted about. And so this envisions that each community action agency would be getting a direct distribution from the department, but then on line 5, this is a different model. If the department and community action agencies agree, there could be a joint allocation that would be just sort of dispersed in a lump fund to the community action agencies, which they would divide among themselves. So that would be a model that sort of follows the work that you did with the Parent-Child Center Network a couple of years ago. Yep. So it gives an option for that. And subdivision 4, consult with, I know, I'm jumping ahead.
I'm jumping ahead.
Consult with the community action agencies and the statewide organizations serving households that are experiencing or that have experienced domestic and sexual violence. To develop appropriate measures and methods for accountability of the community action agencies and the statewide organization's execution of duties under this chapter, including the provisions of any previously agreed upon information to enable the department to evaluate the services provided through grant funds, the effect on households receiving services, and accounting of expended grant funds. Now 5, provide support and technical assistance to the community action agencies, community partners, and the network. The top of page 13, identify specific administrative resources that could be transitioned to community operations. Develop and submit standards for the operation of community-based shelters. And then this directs the adoption of rules in consultation with the community action agencies and organizations serving households experiencing domestic and sexual violence as appropriate for the implementation of this chapter, including accommodations for individuals with disability. And then we have language about regional planning and needs assessment. So we keep cross-referencing back to Title III. Title III, again, is where the community action agencies are designated. So it's part of a plan that's already required by Title III and the federally required planning and needs assessment for the continuums of care.
Can I ask a question?
Yes.
Why are the caps in Title III? Administrative something.
That is where they historically are. And we'll have a chance to look at those statutes in detail because they're in the bill.
Okay.
There are some amendments. Some of the language was, I don't know, maybe a little antiquated.
Yeah.
And so the committee upstairs chose to do a little bit of fine tuning on some of the language.
Okay.
The community action agencies are to develop a regional needs assessment and planning process in collaboration with community and state partners for use in each region to inform future plans addressing housing and homelessness in each region of the state. And the plans shall include, yes.
Okay, I'm sorry to do this to you, but we've heard federally required planning and needs assessment.
Yeah.
Now this is the third time.
Yes. So there are federal requirements around what a community action agency has to report on. More specifics on that, and you'll have to hear from
The community
action agencies.
And part of it, part of my question relates to our wonderful federal government at this time and what may happen or not happen with the potential planning and what that language might mean. So that's it, period.
Yep.
End of conversation, but yeah.
Well, that's my prime concern. We seem to be putting 99% of our eggs in the cat basket. Having chaired my community action board during the Reagan administration, when survival wasn't given, I'm just very concerned about the future of CAPS. I think they're just a little bit further down than the hatchet has gotten, but they've been targeted.
We've got 3 years to go, 3.5 years to go.
I mean,
right. I got it. This is why I'm asking this question.
This is a big.
I don't know how we pay attention to that without knowing the future, but it is a concern. And so we'll just have to sort it out a little bit.
Okay,
so we're on regional planning needs assessment.
We are, and we're looking at the different components. So we're recognizing that there's already work being done, required planning that happens at the state and federal level, and this is adding to that planning requirement. And the component shall include addressing progress to reduce the number of households experiencing homelessness in the region, assessing the rate of households placed in permanent housing, that they return to homelessness and the underlying reasons for that return, identifying resources developed and utilized in the region to address homelessness, reporting the rate of household participation with coordinated entry processes and case management services, identifying system gaps and the funding needed to address those gaps, including periodic inflationary adjustments, and utilizing data, including Vermont's point in time count, coordinated entry assessment results, and community conversations. And subsection B.
Was there any conversation of, well, I shouldn't have asked that, but transportation is a huge issue, but we'll just move on.
Okay.
Should have was.
Each community action agency shall submit plans developed pursuant to this section to the department in a format prescribed by the department. And then the department is to aggregate those reports and submit it to the General Assembly. So all of the community action agencies are collecting this information. They're submitting a report to the department. The department brings that information together, aggregates it, and then the General Assembly gets one report instead of regional reports.
These are ongoing,
Yes.
annual.
Yes. And then we have a section specific to the use of hotel and motel rooms. If a hotel and motel room is used, remember the community action agencies have the choice of how they want to provide shelter to persons in their region, households in their region. So any hotels or motel rooms that are used under this section have to comply with the VHART program rules that will be adopted by the department. Also, the licensed lodging establishment rules from the health department and public safety's fire and building safety code.
We had that in
You do.
113.
Yes.
Yeah.
That's part of this year's budget. Top of page 15, not 5.
15.
You've made it more than halfway. I know it's a big bill.
It's okay. This is great.
Annually, the department is to propose hotel and motel rates as part of its budget presentation that would be approved by the General Assembly. A community action agency cannot pay or cause to be paid with state money at per room, per night basis that exceeds the rate approved by the General Assembly. And then, to the extent possible, if a hotel and motel room is being utilized, a community action agency is to enter into agreements for the use of blocks of hotel and motel rooms and negotiate the conditions of use for those blocks, including access for providers of case management or other supportive services. And also, to the extent possible, a hotel or motel is being utilized, prioritize the use of hotel and motel room agreements over individual per room per night hotel or motel room use unless it's not appropriate to a household's needs. So that is the end of chapter, the new chapter writing, chapter 22, section 3. So that is what is going into the green books.
Okay.
And as you heard, there are details to be worked out that require recommendations. And the concept is that this group, the advisory committee that we'll look at next in section 4, and the implementation that we'll look at in section 5 are part and parcel of building those recommendations that would come back to the General Assembly, and potentially those recommendations would be integrated into the chapter that we just looked at. So section 4, there's created a VHART Implementation Advisory Committee to provide advice and recommendations to the Commissioner of DCF and to the community action agencies regarding the design, implementation, and transition of VHART, including advice and recommendations to the implementation plan required pursuant to section 5 of this act. Worth flagging, I don't know if you want to address it, but as I was walking through this again, the purpose is to provide advice and recommendations to the Commissioner of DCF and to the community action agencies, but it doesn't say anything about providing advice and recommendations to the General Assembly.
Yes.
And it doesn't say anything about providing advice and recommendations to the organization to provide the services to households with domestic and sexual violence. So worth flagging if that is a policy choice that you want to make or change. It's worth flagging that for further conversation. And so this work that this group is doing includes advice and recommendations on the implementation plan required pursuant to section 5, which we haven't looked at. The membership of this group: 5 representatives with lived experience of homelessness appointed by the Chittenden County Homeless Alliance and the Balance of State Continuum of Care. 5 representatives, 1 appointed by each of the community action agencies. 1 representative appointed by the Chittenden County Homeless Alliance. 1 representative appointed by the Balance of State Continuum of Care. And then 5 representatives of local housing coalitions, including at least 2 of whom are shelter providers, appointed jointly by the Chittenden County Homeless Alliance and Balance of State Continuum of Care. The top of page 17, the Deputy Commissioner of ESD or designee, and then the Director of OEO or designee.
Just a quick question on the Chittenden County Homeless Alliance and the Balance of State Continuum of
Who's the
Care.
balance?
Are they organizations that are going to persist after this is implemented?
I believe so. Those are the continuums of care. I believe they're federally designated.
Yeah.
That probably goes to your question. Your
Yeah.
point previous.
Yeah, it does.
Yeah. So I think you should ask that question of witnesses.
We will,
Yeah.
but just wanted to highlight that. We're good.
There's also a sunset on this committee at the fall.
Yeah, we'll see it.
So
And all the federal piece as well. Okay.
Yeah. So that is the membership of the advisory committee. The advisory committee has the assistance of DCF, the commissioners to call the first meeting. That's a holdover from a previous draft. So we need to identify. There had been the commissioner of DCF. So you might want to say the deputy commissioner. Or
Is that who it
designee.
is? It's going to be Economic Services Division?
We have, I mean, that's a policy choice.
We'll have to decide.
Yeah, but that would be,
Who did they actually decide on?
I don't know if we got there.
Okay.
So there was an earlier draft where the commissioner of BCF and commissioners of all of AHS really were
Okay.
on that.
Okay.
I
I think I looked at an earlier draft.
let me flag that. Okay.
All right.
So the first meeting, which will occur on or before July 15th of this year, the committee is to, the committee shall select co-chairs from among its members at the first meeting, at least of one of whom is not a state employee. So I think we need to find somebody else to call that first meeting. We don't have a chair.
Okay.
Before the.
And they talked about the co-chair issue and how that.
They purposely selected co-chairs. I think part of the thinking of that is, if you have taken a look at the opioid settlement abatement, do you still have 218? Yeah, you still have 218. Maybe we will note this when you get there, but a conversation that Human Services had was that because the commissioner of the health department is the chair, that it felt awkward to ask just a member who was not
the chair.
Yeah, to comment and speak on behalf, and they wanted an opinion that wasn't just the state government opinion. So I think that bill being taken up right before this bill probably influenced the request for co-chairs. Okay, majority of the membership constitutes a quorum. And then we have language that the advisory committee may divide into subcommittees to carry out the duties under this section, and subcommittees may include individuals that were not appointed to the advisory committee pursuant to subsection B. This would include representatives of individuals who are older Vermonters, individuals who have disabilities, substance use disorder, or mental health condition, individuals re-entering the community after incarceration, individuals transitioning from the care and custody of the Commissioner for Children and Families, and families with children. And then we have our compensation and reimbursement language. This would be per diem and reimbursement of expenses for not more than 12 meetings annually. And this group is time limited, as we heard, and it expires July 1, 2029. So when you think that through, this group would be functioning as of this fiscal year 26, starting July 1. So it would be a year of planning, and it would get through the first, let's see, 26, 27, 28, the first 3 years of the program. And now we have the implementation plan. So this is what the General Assembly is going to be getting recommendations back on to really inform the work and fine tune that section 3 chapter that we looked at. So on or before February 1st of 2026, DCF, in collaboration with the community action agencies and in consultation with the departments of AHS, and the VHARF Implementation Advisory Group established pursuant to Section 4 of this Act to submit a plan to the General Assembly. Again, I'm noting that the organization that's providing services to individuals with domestic and sexual violence are not identified as this list. I think they could be called, you know, community partners, but it might be worthwhile to decide if that is an intentional choice. Is that something you want to address or not?
Well, certainly through the rest of the bill, so.
Okay, so they're to submit a plan to the policy committees that ensures maximum flexibility for the use of resources and streamlines processes for program participants. Specifically, the implementation plan shall address, this is a long list of what's coming back to the General Assembly. Funding allocations by February
2026.
to give time.
Right.
I mean, the idea is that it would be a committee bill in human services, and that's probably the last
big committee bill here. We're getting
Oh,
used to
that's
that.
true. You could do
Be
it
anywhere.
You could do a committee bill here. But that's sort of the last possible date to get a committee bill going and getting it out before crossover. Okay, so funding allocations among the community action agencies and other providers, including for services specific to households that are experiencing or that have experienced domestic or sexual violence. Additional state and federal funding and other resources identified for the program. Appropriate measures and methods of accountability in fulfilling the intent of this act for community action agencies. The organizations serving households that are experiencing or have experienced domestic and sexual violence and community partners. Appropriate supportive services specific to the level of shelter a household utilizes or whether the household is at risk of homelessness or experiencing unsheltered homelessness. If you remember way at the start of this walkthrough, we looked at a list of supportive services, and I made the comment that the language says that these services will vary by amount and to whom, and that is something that is going to be reported back on. This is the corresponding report back on those services. And subdivision 5, establishing an appeals process that includes a hearing before the Human Services Board and an option for an expedited appeals process. Subdivision 6, expanded use of 211 within the intake system. Subdivision 7, whether continuation of emergency shelter should include an expectation regarding household participation in case management services or other expectations such as night limits on the use of hotels and motels. And if so, what elements and in what circumstances participation in case management services or other expectations should be applied. Subdivision 8, whether the use of emergency shelter should include financial participation, and if so, what that participation should include. Subdivision 9, how prioritization should occur for emergency temporary shelter and what priority categories should exist within those parameters. So when we looked at emergency shelter, there were 2 paragraphs. There was the temporary and the transitional, and I noted that one says prioritize certain populations, the other one didn't. This is saying, okay, so how are we going to prioritize for that one group? Subdivision 10, how to best ensure that there is equitable access to shelter and supportive services for households experiencing homelessness. Subdivision 11, the appropriate level of required intake and assessment processes for each of the various levels of shelter that a household may utilize for households that are at risk of homelessness and for households experiencing unsheltered homelessness, and any anticipated challenges requiring a legislative action solution.
So as I'm thinking about this little implementation plan recommendations, one of the things that becomes really important, and it is mentioned once in one of these, is the intent of our legislation. And I think we probably should go through the intent at some point with more of a fine-tooth comb, so we're clear on what our expectations are. Because the concerns that I've had about what's happening with our VAA and others is the intent has gotten lost. My car. I need to move my car. So not yet.
Still using my parking space for 2 days. So I have to move it around to a loading dock.
So
You can't
we're,
leave.
we're transitioning now from the implementation plan to Title III, which is where the community action agencies live in statute right now. I think this piece of it can go a little bit faster, if that's okay. I know there's not as many changes. So right now, the term used in statute is community service agencies, but that is not what happens in our communities. And it seemed appropriate to update to community action agencies. So that has been done. And that is one of the changes you'll find throughout this chapter. Other changes you'll see is, as I said, some of the language was found by the committee to be a bit antiquated. So I've tried to update the language in a way that reflects how drafting occurs now. So, for example, we have in current statute, it remains evident that poverty continues to be the law of a substantial number of Vermont's population. And instead it would read, it remains evident that a substantial number of Vermont's population continues to experience poverty.
That's good.
Other changes. Right now we have utilization of a range of services related to the needs of the poor. We replace the poor with individuals with low income. So we've done that a few times. I'm on page 21, but I'm moving quickly to page 22. So on the bottom of page 21, instead of to assist low income, supporting facilities designed to assist low income. We've changed it to participants with low income. So we have person first language. Slightly more substantive. This is a list of what the components of the services that are to be provided to participants with low income, striking out provided to provide and maintain adequate housing and a suitable living environment to have access to safe, secure, and permanent housing. In subdivision 5, there is language to obtain services for the prevention of narcotics addiction, alcoholism, and for the rehabilitation of narcotic addicts and alcoholics, which has been updated in this draft to obtain prevention, intervention, treatment, and recovery services for individuals with substance use disorder.
I'm just wondering what's the era of that language? Like when
Okay, well, like 70s, maybe earlier.
Okay.
Oh, I would, yeah.
Yeah.
60s or
I could give you a specific date.
It's okay.
I don't have it at my
That was
computer.
the original community action language.
Yeah, it has not been amended.
A question of how much, how much of the language was driven by federally required language?
So when we were working on this language, we had the director of OEO in the room, and
All right.
I think
We'll do that.
I got the sense from what she said that she felt comfortable with the changes that were being made.
Yeah, no,
I
that's
don't
good.
think we have a.
The other issue here is ensuring that all this language meets our legislative intent going forward.
Same kind of changes,
Yeah.
updating usher to ensure, using person first language, persons with low income, changing community services agency to community action agencies. Here is a more substantive change. The community services plan shall be completed every 3 years and updated annually. And that, I believe, is a reflection of what is happening already. And then there's this language, the plan shall include the regional needs assessment required in Title 33. So this is cross-referencing back to the language we just looked at that requires a regional planning assessment. And in that section, it says, in addition to what you're doing in this section, make sure you're including a regional needs assessment. So we're just adding a cross-reference that kind of brings the reporting requirement and regional needs assessment together in one place. These are all small changes. Okay, subsection C at the bottom of page 24 is a substantive change. What's happening is currently it says no person This is talking about the boards of each community action agency. It says no person selected under these subdivisions as a board member shall serve on a board for more than 5 consecutive years or more than a total of 10 years. The proposal is to strike that and say that each board shall adopt term limits to govern its members. So it wouldn't be set in statute. The boards themselves would control the terms.
You want to lose somebody board?
Boards, yeah.
Okay, because when I was there for 10 years because I was a local rep and they wouldn't have term limits. Nobody else wanted it, but everybody else did. And it was divided because there had to be representatives of the low income community and representatives. So that's changed. So, okay.
So this would let the board itself decide what the limits would be.
Senator Beck, we're probably going to be 5 or 7 minutes at least.
Okay.
It's up to you.
5 or 7. Okay.
Maybe 10.
We have 2 pages to go.
Yeah,
We're getting close.
Talk to
I was
us.
looking
I
at,
I have
looking at
it.
Nolan also, we might be able to put Nolan at, see how.
Whatever you want to do.
I know.
I can go after Senator.
Okay, that might work. Okay, finish it.
So appropriations, as you have heard from Representative Wood, there is an appropriation for this fiscal year of $10 million in one-time funding to prepare for the transition. So 6.5 of that would go to DCF for the distribution to community action agencies and the organization serving individuals, or I shouldn't say individuals, households experiencing or who have experienced domestic and sexual violence. $500,000 to DCF for contractual and other system transformation assistance. And then $3 million to DCF for the continued development of shelter capacity in the state. So that's this year's appropriations. And then we have intent language about future appropriations. So not a surprise, you've seen this in the purpose section. It's the intent of the General Assembly that in fiscal year 27 and thereafter, equivalent funds and resources based in one time used in fiscal year 25 for GA emergency housing and the Housing Opportunity Grant Program be redesignated for VHARTH. And then the effective dates, we've already sort of talked through, but the bill itself takes effect this year. Oops, my screen sharing paused. Oh, my screen looks different than your screen now.
Yeah.
I'll just stop sharing. So the bill itself takes effect this year, July 1. But section 3, which creates that new chapter and effectuates the new VHARTH program, would not take effect until July 1, 2026. So all of the planning happened this year, and then it takes effect next year.
A lot here.
There's a lot.
Well, we will. So we will be scheduling our testimony on this bill very quickly. And well, so thank you. Nolan, we're gonna have Senator Beck come up first, and then we'll. But I think we should be able to get back to the fiscal bill. So, Senator Beck, you have a proposal.
Yeah.
That's in the calendar.
Right.
That relates to the BAA H489.
Right.
And our committee has been very much engaged in the homeless issue. So if you don't mind,
Kiki, we have copies of the copies it's posted.
it's on our webpage. Let's look at it. So, I think generally it takes the governor's executive order and puts it in a statute. Is that
That's
really
correct.
what's happening?
That's correct.
Okay. So why don't you walk us through it?
Okay, thank you. So as the chair said, this codifies what the governor executive order that he issued last Friday. And specifically the changes into visa 3. The department shall provide emergency winter housing to households meeting the priority eligibility criteria defined in subsection 1 of this section between April 1st of this year and June 30th of this year households meeting the priority eligibility criteria during these months shall be prioritized ahead of households meeting only the eligibility criteria in subsection A of this section, which is the 80 days, and who have remaining days on their fiscal year 2025 allocation for emergency housing. So that's the change. The priority eligibility criteria that are set out in the executive order and its amendment is that the household had to have been housed in a hotel or motel pursuant to the section by March 31st of this year. That the department has determined there is sufficient medical evidence and documentation that a household member has a medical condition listed in the subdivisions of the subsection. And the household has a member who meets, those are the household has a member who meets one of the following. Is a child 19 years of age or under, meets the Medicare definition of homebound, requires life-saving device that requires access to electricity, is in active cancer treatment or treatment for severe kidney disease or renal disease, or in severe liver or heart conditions, is actively receiving Medicaid eligible or Medicare eligible home-based nursing services, or last is in the third trimester of pregnancy, or who will enter the third trimester between April 1st and June 30th of this year. And so that is the amendment. It is like, as your chair pointed out, it codifies, puts in statute what is in the executive order that was issued.
Basically,
Do you know what?
That typically, yeah.
Can you explain what the federal rule 405 means, the homebound?
Are you looking at
I'm looking at page 3.
C sub II?
Yeah,
I do not know the
okay,
details.
that's all right.
Yeah, I know it's a code of federal regulation, but the details I have not looked at.
Yeah. All right, and then, okay, so essentially this puts this establishes a new priority group that wasn't in the underlying 113 or 489.
That's correct.
So yeah, okay.
So these people would have priority over the
Right.
general population. Yeah, that's right.
And okay. And we know based on what we've worked on previously, some people are left out.
It is a restricted group.
It is
Yes,
restricted.
it is
We got
restricted.
it. Okay. All right.
priority to what?
Huh?
What do they give priority?
Shelter.
I thought we were doing away with motel shelter.
Well, that's what we're working on it here. This is.
No. After 80 days are up, they're leaving across the street from me. I'm watching them. I got one guy with his
Okay.
stuff in the grocery bag.
Yeah.
So if they're leaving, what are these people being given priority to?
My understanding is they're being given to priority over people that do not fall within this list that have things remaining.
That's exactly right. So if somebody has some of their 80 days remaining and if somebody needs a room, the people who need the room replace the person
Who still has
is
80
not in
days
the
remaining,
category
who
list.
might be 3 months pregnant and nauseous and throwing up.
I was going to say the
24/7.
same things. That's true. Yeah. Exactly.
I have a mother
that's
who
correct.
was threw up for 9 months and was hospitalized with dehydration.
I was going to.
Yeah, it is, I mean, it
It's
is what it is.
different.
It's a restricted list.
It's very
Yeah,
different.
yeah.
Okay.
Yeah.
All right. Any other questions for Senator Beck?
First time I've ever been in this. That's
Well,
fun
it's a
here.
pleasure
It's a
to
lovely
have
room.
you under the situation that we're having you here. But we like having
Like you
you
got the
here.
flagpole right out there.
Maybe we'll get you back in
Yeah.
on some things that we can.
All right.
All right.
It's good to see you all.
Good to see you.
All right.
Okay. So committee, that is the proposal. We brought it in here because it very much relates to policy that we had worked on and recommended during 113 and then continuing with our legislative intent through the rulemaking process and then also through 489. So I'm looking for a straw poll for those who would support the amendment. Would you support the amendment as proposed by Senator Beck? If so, raise your hand. All right. For those who would not support the amendment, say no, raise your hand. No, okay. That's all I need to know. We're good, and I will respond to this on the floor. There's a lot here. A lot here. So we're on our way. Good. So Nolan, we're going to move back to 91.
Would you like to have a discussion about if we don't like that?
Go for it.
Well,
Yeah, sure.
I was in favor of it, but personally, I'd like to see more openness for people that aren't just 3 months pregnant. Personally, I'd like to see better than that. But I also was in favor of that as it is, so it's really up for you to leave that one.
Okay. And I understand that, you know, for both you and Senator Hart, you haven't been here historically to understand legislative intent and how we've worked on this, the benefit, the general assistance benefit, or on the hotel motel programs that's been going on since the pandemic. So I understand that you may have a slightly different perspective on this, but I will tell you that there are some significant issues that are that significant legislative intent is being ignored significantly with that proposal, and that's why I will speak against it on behalf of the majority. Okay, and I was going to say same thing that Senator Cummings said. I remember those days. Okay. All right, so Nolan. We have a fiscal note
Yes.
on our webpage.
Still share my screen.
I will say this, that our intent in fixing the homeless issue is not a partisan issue, nor should it be. It's becoming that very rapidly, and it's unfortunate.
We have a terrible issue.
Yeah, so that's why we're here. Hi.
Morning. For the record, Noel Langwell, the Joint Fiscal Office. I will be brief because you've already had several walkthroughs. So I'm just going to flag 3 things from my fiscal note, and not necessarily in order. First thing that the bill does that I'm going to flag is Section 7 has a $10 million appropriation. So that's Representative Wood talked about the appropriation of the bill. Now, I want to be clear that the way this is working right now is that there's no change in the budget. So step aside and talk about the budget. The governor's recommendation in the budget that is now in your chamber is the continuation of the existing system without any of the proposed changes. That's the House sent that over, basically saying, okay, for 26, that's our placeholder. That's what we're going to do. They decided that any change to the program would be a separate bill. So I just wanted to just clarify that clarification. What's in the budget is just the existing program as it exists currently, without any of the proposed changes in VA, etc.
And that's on your last page of your note.
You know what I missed? Okay.
Yeah,
what the House decided to do is, okay, take how we're going to address 26 and leave that in the budget. And then their plan is to make changes to the program for 27. And that's what this bill does. So the only appropriation that this deals with specifically is the $10 million. Now, and that's the only 26th appropriation. Now, what I keep saying to people is that by passing this bill, you are making a commitment for a year to change 27, whatever that will be. So that will be whatever is proposed in the governor's budget. Representative Wood also talked about how there'll be a companion bill to help guide whatever the legislative intent going forward will be. So I just wanted to just differentiate that from what's currently happening and what you're going to be talking about on the floor later from what's in this bill. So the bill really focuses on 27, with the only thing for 26 being the appropriation for $10 million and the advisory committee, which I'll get to in a second. So there's $10 million one-time general fund appropriation, DCF, $6.5 million for distribution to CAPS, 500,000 for contractual and other system transformation assistance, and $3 million for the continued development of shelter capacity in the state. Second piece that I want to flag that has the 26 impact would be the implementation, the VHERF Implementation Advisory Committee. This has per diems. So folks who don't do this as part of their normal job or aren't state employees are allowed to collect per diems. The per diems, I think I estimate will be around, they shouldn't be more than $7,000 per year. So that they're quite nominal and can be absorbed within DCF's budget. So I don't think you need an appropriation for that, but there's a fiscal piece. So I had to flag that. And then the third piece, this is so there's legislative intent that the money that's in the system would be spent going forward. The legislative intent is specific to fiscal year 25. So whatever spending was fiscal year 25 would be redirected for this new program, for the VHERF program. Now that's legislative intent. It's not binding, and the decision that'll be next year's conversations about, when you're planning, assuming this bill passed, how much money is appropriate for 27 will be the conversation between what the government proposes and what you guys decide to do. But have that conversation, you need to understand what's in the system. And so this is an attempt to sort of help you understand what is currently in the system. So you can see I split up between the GA and the HOP. So for 25, fiscal year 25, you've got 37.5 million, and this is what's budgeted for GA housing. There's 7.5 million for the hotel motel vouchers, and there's $840,000 for security, those at the hotels and motels. And then there's 26.10 for HOP, and then 10 million for expanded shelter capacity. 26 GovRec. Now this is what's in the governor's recommendation. That what I should have done was I should have seen what was in the House proposal, but this was put together before the House had passed their budget. I will actually look and see how it's different. But the GovRec was 30.5 million for GA, and that was based. The drop is based on how much money they were actually spending versus how much was appropriated. Now you can argue part of that is because there wasn't enough capacity, but nonetheless, that's something they're basing it on. Estimated capacity and actual utilization that they're seeing for 25 is what drove their 26 numbers. And so I can tell you that that's what the House budgeted as well. And then 7.5 again for the vouchers, and the hotel security dropped from 840 to 500. Again, that's based on what they're seeing from experience. And then there's 29.8 for HOP, and then another 2 million from 10 for expanded capacity. On the far right, this is important. You can see which is one time, which is base. And this is important because when you think about money going forward, one time versus base is very important. So this was intended to help you understand what's in the system. And I built in some administrative costs. So for instance, in the GA housing, in that 37.5 and the 30.5, that includes 10 limited service positions that were hired last year. So that's built into that number as well. I do my best to capture. There might be some money elsewhere that DCF's using that might be redirected, but this is the big picture of what I know is in the system currently that would be part of the conversation for what 27 could look like next year when you have this discussion, assuming this bill passes.
I'm sure we'll have a robust discussion in appropriations on this. So our goal in here is to really ensure that the policy is something that meets our intent to reduce homelessness and move forward. Thank you.
Great. Now you need to move your car. We are